My name's James from Binary Plus Training, making your first aid our first priority. Due to the current Covid-19 outbreak, the Resuscitation Council, the people who decide what the best protocols are to use for resuscitation, have updated their guidelines. And what I'm going to do is I'm going to go through some of the changes and some of the tweaks that have been made to those guidelines so that you can still provide help to people in your workplace or in your community, and you can do that lessening the risk to yourself. Just because Covid-19 has happened doesn't mean that cardiac arrests will stop, and still early CPR, good effective early CPR and early defibrillation are still really, really important and will still save lives. So you come across your what appears to be unconscious casualty, and you're not going to do anything until you've considered your PPE. So that's gloves go on first thing. That's your first thing that you're going to do. As you're approaching, you'll do the normal verbal Annie, Annie, can you hear me? We get no response. So we're going to do the, like we would before, shake and shout or tapping on the shoulders. Annie, Annie, can you hear me? Annie, open your eyes. You'll notice that normally on our courses I will teach you to say commands into both her ears. Due to the current outbreak, we're not going to get our face that close to hers, so everything's going to be done that little bit more remotely. So we've checked for a verbal response, we've checked if she's responding to us physically, and we've got no response. Now normally we would open the airway next, which is exactly what we're going to do now. So 2 fingers under the chin, hand on the top of the head, extend that airway back. Normally the next step would be to look, listen and feel for regular normal breathing for up to 10 seconds, and you'd normally do that by putting your face over the person's mouth, but due to the current outbreak we're not going to be putting our face over Annie's mouth. What we're going to do instead is keep our hand on the top of her head to keep the airway open, place our other hand on her chest, and we're going to use our eyes and our hands from this little bit of a distance to see if we can feel that rise and fall in that chest, to see if we can see anything happening as far as breathing goes. So we're going to check like normal for up to 10 seconds. If we don't get any regular normal breathing, then we are going to start CPR just like we would normally. Obviously at this point we're going to need to make sure that help is on the way. That could be shout somebody else to do it, that could be dialing 999 on your mobile phone, popping it next to you on loudspeaker, whichever way. Don't start CPR until you've got help en route. So the 2015 Resuscitation Council UK guidelines state that if you are untrained or unable to use rescue breaths, then give chest compression only CPR, which is what we're going to do in the current climate. We're not going to be putting our mouth on their mouth because that's the primary way that the infection is transmitted. But that doesn't mean we're not going to help. That doesn't mean we're not going to do CPR. So CPR just like normal, but we're not doing the breaths. So heel of your hand in the middle of the chest and interlocking the fingers. There is one more thing you can do if you've got the something around in order to be able to do it, and that's either a shirt or something like that, and you're just going to lay that over the person's mouth. The reason being, when we apply that compression, air is going to come out of the person's mouth, and we don't want that in such a close proximity to ourselves. So putting a cloth, a towel, a bit of a t-shirt, something like that over the patient's face before you start your compressions can reduce the risk of infection from the air that's being expelled from the lungs. But yeah, your compression's only CPR, heel of the hand in the normal place, interlock the fingers as normal, altering your body weight so that your body comes up over the person's chest, still doing it at your normal rate of 100 to 120 beats per minute, but you're not going to stop for breaths. So you're going to start 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and then just keep going. So normally you would have stopped there and you would have delivered your 2 rescue breaths. What we're doing at the moment due to the Covid-19 outbreak is we are just continuing the compressions. As normal, if there is more than one person there, every 2 minutes you need to swap. So just keep going with those compressions. When you get to your 2 minutes, swap with somebody else. So for adults, those are the alterations to the guidelines. Obviously, once the ambulance arrives and they have dealt with the casualty in whichever way they want to do, it's very, very, very important that you go and wash your hands. Alcohol gel is a convenient alternative, but it's not as good as soap and warm water and giving those hands a really good wash. 2 rounds of happy birthday, give your hands a good wash. Make sure you dispose of your gloves, put them straight in the outside bin if this is something you're doing at home. As you pull them off inside out, so that way whatever was on the outside is now on the inside, and then dispose of those gloves in the outside bin. Wash your hands properly, and probably a good idea to change your clothes as well, because you've been very, very close to somebody. So clothes off in a nice good hot wash in the washing machine. I hope that was beneficial to you. Remember that protocol only applies in the current Covid-19 outbreak, and it only applies to adults. It is still really, really important that with children and infants we get those rescue breaths in, because statistically an adult who is not breathing is due to a cardiac problem, which means their heart has stopped beating first, so it's the heart that we need to focus on. With a child, if they're not breathing, chances are they've gone into respiratory arrest first, which means they've stopped breathing. Their heart may still be going, so getting those rescue breaths into children is still really, really important. Infection risk is a concern. There are things that you can use. There are things such as pocket masks and other barriers that you can use between yourself and the child or infant. But with children and infants, please remember, still do your breaths. Well, that's it for today. Don't forget to like and subscribe to keep yourself up to date with all the current practices with first aid. We're going to be putting out lots of videos over the next few weeks, so do keep your eye out for those. My name's James, and remember, I'm from Binary Plus Training, where we make your first aid our first priority.